Welcome to the cadaveric demonstrations conducted by the Department of Anatomy, Faculty of Medical Sciences, University of Sri Jawadharpura. Today we are going to demonstrate the triangles of the neck, including boundaries and the contents. Let's recall the anatomy on general arrangement of the neck. When we are dissecting, the first covering is the skin. So we have removed the skin in this specimen. Next, we see the subcutaneous fat layer. After that, we find the superficial fascia with the platysma muscle. Please note that we have already removed these layers to show you the triangles more clearly. Deep fascia of the neck can be divided into investing layer, carotid sheath, prevertebral fascia and pretracheal fascia. It is the investing layer of deep fascia that covers the neck as a collar. And in this specimen, we have removed the investing layer of deep fascia also to show you the structures more clearly. There are two important muscles that are wrapped by the investing layer of the deep fascia. They are the sternocleidomastoid muscle and the trapezius muscle. Now this muscle, which runs obliquely across the neck, is the sternocleidomastoid muscle. You can nicely see it's got two heads. The head that had been cut is the sternal head, and the head that is here is the clavicular head. So from the mastoid process, it goes and attaches to the sternum as well as the clavicle. Superficial to the sternocleidomastoid muscle, you find this important vein, which is the external jugular vein. Remember, external jugular vein is superficial to the investing layer of deep fascia in a normal person. The other important muscle is the trapezius muscle. So this is the sternocleidomastoid muscle, and from this edge of there's another muscle that goes, that is your trapezius muscle. So the sternocleidomastoid muscle and the trapezius muscle has divided the neck into two triangles. The anterior border of the sternocleidomastoid muscle, the lower border of the mandible, and the midline forms a triangle. And this is called the anterior triangle. Let me show you the borders again. Anterior border of the sternocleidomastoid muscle, lower border of the mandible, and the midline forms the anterior triangle. Now we look at the boundaries of the posterior triangle. The posterior border of the sternocleidomastoid muscle, the anterior border of the trapezius muscle forms, together with the middle 1/3 of the clavicle, forms the posterior triangle. Out of the contents in the posterior triangle, and the nerves are the most important structures. The point where the inferior 2/3 meets the superior 1/3 on the posterior border of the sternocleidomastoid muscle is called the Erb's point. Out of the nerves that emerge from that point, the nerve that you see here, which is running across the sternocleidomastoid muscle, is called the greater auricular nerve. Greater auricular nerve. The other important nerve is the nerve that runs like this towards the trapezius, which is the 11th cranial nerve or the accessory nerve. Let's look at the accessory nerve again. So it emerges behind the sternocleidomastoid muscle at the Erb's point and run inferiorly to enter the trapezius. And this is the accessory nerve. The flow of the posterior triangle is formed by the prevertebral fascia covering the vertebral muscles, picking up the prevertebral fascia. The roof is formed by the investing layer of deep fascia that runs from the trapezius to the posterior border of the sternocleidomastoid muscle. Now, let's look at the further subdivisions of the anterior triangle. To visualize better, we have cut the sternocleidomastoid muscle and now I am retracting it so that you can see the structures better. Once we remove the sternocleidomastoid muscle, we can see the hyoid bone. Once we remove the sternocleidomastoid muscle, it's easy for us to look at the further subdivisions of the anterior triangle. Another important structure that you see here covered by muscles is the hyoid bone. Let me point that again. The bone here is the hyoid. There are muscles above the hyoid and there are muscles below the hyoid. The muscles below the hyoid are called the infrahyoid muscle and the muscles above the hyoid are called the suprahyoid muscle. Out of the infrahyoid muscles, the muscle that runs obliquely towards the scapula is called the omohyoid muscle. Let me show that muscle again. So from the hyoid, this is the omohyoid muscle which runs obliquely crossing the internal jugular vein. So the tendon lies superficial to the internal jugular veins. Then out of the suprahyoid muscle, now please note that we have removed part of the mandible here to show you the deeper structures in this specimen. In this, we can see there is a muscle that starts from the mastoid, comes down, attaches to the hyoid and goes up. And it's got an anterior belly and a posterior belly. So this muscle is the digastric muscle. Let me show you again. So that is the anterior belly, that is the posterior belly. And there is an intermediate tendon that connects to the hyoid. Because of this omohyoid as well as the digastric muscle, the anterior triangle which was formed anterior to the sternocleidomastoid muscle can get subdivided. The triangle formed between the arbitrary midline, anterior border of the belly of the digastric and the hyoid bone is called the submental triangle. Again, the arbitrary midline, hyoid bone and the anterior belly of digastric forms a submental triangle. The flow of the submental triangle is formed by the mylohyoid muscle which had been cut here. So that is the mylohyoid muscle which is being cut. So the flow is formed by this mylohyoid muscle and it contains lymph node. Then imagine if the mandible was in situ, there is another triangle formed by the lower border of the mandible, the anterior belly of digastric and the posterior belly of digastric. So that is called the submandibular triangle. The content is the submandibular gland which is seen better on the other side, and I will show you again on the other side. The triangle formed by the posterior belly of digastric, superior belly of omohyoid and the anterior belly of sternocleidomastoid muscle is called the carotid triangle. And if I retract it, you can very clearly see the contents of the carotid triangle, which is the internal jugular vein, the common carotid artery, right? Let me show you again. Let me put the sternocleidomastoid muscle. So that is the posterior belly of digastric. That is the anterior border of the sternocleidomastoid muscle. This is the superior belly of omohyoid, and this forms the carotid triangle. Then the arbitrary midline part of the hyoid, superior belly of omohyoid, and again the anterior border of the sternocleidomastoid forms another triangle which is the muscular triangle. So you have the submental triangle here, submandibular triangle here, carotid triangle here, and the muscular triangle here, which are the subdivisions of the anterior triangle. Now let's look at from this angle. Again you can see the anterior belly of digastric, anterior belly of digastric. So the triangle here is the submental triangle. So in this side we have not taken the mandible out. So we can see the anterior belly of digastric, the hyoid and posterior belly, which is not clear, but if we remove this we might be able to see the posterior belly more clearly. So this is the submandibular triangle with the lower border of the mandible. So the contents, this is your submandibular gland together with the facial artery and the facial vein.